Dry needling is a soft tissue treatment technique that focuses on releasing trigger points. The technique involves using a thin filiform needle, which is the same that they use in acupuncture, to release these knots and taut bands of musculature. The technique involves penetrating the dysfunctional musculature with the needle and manipulating it to create a release. Often when you have that release, you'll elicit a local twitch response, which can be felt as a quick twitch or contraction of the muscle. This technique is really useful in releasing tightness that can limit range of motion and also create pain. Today we're going to demonstrate the dry needling technique on a patient experiencing neck and shoulder tightness. Our patient is lying prone and her pain is in the upper left quadrant and refers up to the back of her skull. We start by palpating to find trigger points and determine which ones are relevant to her symptoms and may reproduce them. The next step is to prep the region with alcohol to make sure we have a sanitary needling environment. Then we put on sterile gloves and sanitize again with hand sanitizer. And now we begin the needling process, in which our goal is to elicit a local twitch response and release trigger points. Once the treatment is complete, you may notice a little bit of soreness, but also increased range of motion and reduced pain. The muscle will also be stronger on isometric testing. The trigger points that we're releasing are essentially tight musculature that are stuck within a contracted state. This can be explained easily by imagining a rubber band. If a rubber band cannot stretch, it can also not contract forcefully. Once we restore the ability of the musculature to stretch fully, it will then also be able to reach its full potential of strength. So as soon as we finish releasing these trigger points, we want to use this as a window of opportunity to establish more flexibility and improve core strength and stability. And with all symptomatic treatments, we have to focus on treating the causes of those symptoms, such as postural dysfunction, inflexibility, and core weakness. So once the symptoms are treated and posture and stability is improved, we can develop a home program to help maintain these improvements and prevent the trigger points from returning.